telemedicine, and telenursing. Telemedicine is defined as the use of telecommunications that deliver healthcare expert sharing of medical knowledge with persons at distant locations. It is transfer of medical data for consultations, diagnosis, support for clinical case, containing medical educations, medical data such as high-resolution photography, radiological images, sound and patient records, electronic signals via the Internet, intranet, personal computers, telephone lines. History of telemedicine. University of Nebrastea did first documented use of visual telecommunication in healthcare in 1959, under first telemedicine program in December 1988. The site of massive earthquake in Armenia was linked to medical centers in United States for telemedicine consultations. The program was extended to Russia to provide telemedicine consultation to burn victims after a terrible train accident. First Internet-based telemedicine trials were conducted in April 1955 when a Chinese study Xi Ling, who was studying in Beijing University, fell sick and her condition could not be diagnosed in China. Telemedicine applications: emergency health care, video consulting, telecardiology. Telemedicine as applied by cardiologists is called telecardiology, telepathology, teledermatology, teleophthalmology, teleoncology, telepsychiatry, teledentistry. Distance learning, medical education and the transfer of medical data, medical care delivery, diagnosis, consultation and treatment at a distance, nursing homes or retirement centers, home monitoring for patients, healthcare in the after of disasters, major telemedicine projects, teleconsultation, a doctor of a paramedic or even a patient himself in remote area can have a consultation with a specialist. This requires certain procedures to be followed. The person initiating the requires needs to be trained, and more importantly the complete process needs to be documented for the patients and the doctor's record. Teleconsultation also involves a family doctors seeking help of specialist in an emergency, also involves getting radiological or pathological opinions from the best specialists. Tele-education. The use of telemedicine technologies makes it much better than just surfing websites for information. Doctors can attend clinical meetings as remote places and also participate in present cases in them. Some projects such as HealthNet project of Africa uses both internet and satellite communications for doctors in remote area. If this is dealt using telemedicine, the approach is real-time. The referring doctor knows how the specialist is dealing with the patient and thus further his knowledge. Teleconsultation, video conferencing on surgery, online clinical audit and containing medical education are just some of the education applications of tele-education. Telemonitoring. Telemonitoring is the remote monitoring of patient data. The patient's status can be monitored wherever he is, whether in an aircraft or in remote village, as long he has a telephone access. The data includes blood pressure, pulse, ECG, spirometry, ultrasound, CT scan and other radiology data. These can be transmitted using telephone lines or through wireless with the use of appropriate devices that can transmit these data over phone. These devices are commercially available and can be attached to any telephone line. Benefits of telemedicine: resource utilization, early intervention, avoids unnecessary transportation, community-based care, medical education and research, cost saving, improved patient documentation, increased range of care and education. Resource utilization. First benefit of telemedicine is proper utilization of resources. In India, doctor population ratio is 1:15,000 in comparison to 1:500 in developed nations, and these doctors are not distributed Modalities of data transmission in telemedicine. Telemedicine devices, video conferencing system, roll-about systems, set-top systems, desktop system, peripheral devices, medicals peripherals, non-medical peripherals, limitations to spread of telemedicine, poor patient-doctor relationships, patient acceptance, fear of technology, low rates of utilization, infrastructure, barriers to telemedicine. There are still several barriers to the practice of telemedicine. Many countries will not allow but of country physicians to practice, unless licensed in the country. Many rural areas still do not have cable wiring or other kinds of high bundle width telecommunications. Access required for more sophisticated uses. Future of telemedicine. Many medical centers in India are now successfully running telemedicine projects and video conference. Future of telemedicine in India is definitely bright, with availability of internet everywhere, with new informations technology policies, and with improving telecommunication network. Use of telemedicine is going to increase. Indian scenario of telemedicine. Now, with the availability of internet connection in most cities of India, interest in telemedicine is increasing day by day, but still, major drawback in India is that communication network is not suitable for most telemedicine applications. ISDN lines are not available in most of the places in India, which is basic requirement for video conferencing. Indian scenario of telemedicine. Now, with the video conferencing technology will be limited to some big cities, and telemedicine technology that will be used in most of the parts of India will be store and forward technology. It will be like sending radiological images, patients' records, sounds through email or modern, and getting opinion of experts. Many medical centers in India are now successfully running telemedicine projects using video conferencing. India is an ideal place to use this technology, as 80% population in India lives in villages where treatment is provided by queen and unqualified medical practitioners. Video conferencing technology will be limited to some big cities, and telemedicine technology that will be used in most of the parts of India will be store and forward technology. It will be like sending radiological images, patients' records, sounds through email or modern, and getting opinion of experts. Many medical centers in India are now successfully running telemedicine projects using video conferencing. India is an ideal place to use this technology, as 80% population in India lives in villages where treatment is provided by queen and unqualified medical practitioners. Definition of TELENURSING. Telenursing is a subset of telehealth in which the focus is a nursing practice via telecommunication. By American Nurses Association, telenursing is defined as the practice of nursing using protocols through telecommunication technology. Arkansas Staff Board of Nursing. The practice of telephone nursing. Standards and Quality Center is telephone nursing. Competencies required in telephone nursing. High-quality practice settings. Decision support systems. Using nursing titles applies to telephone nursing practice. Designated agent. LUNS and telephone nursing. Guidelines for TELENURSING. Nurses and midwives practicing in telenursing shall be registered nurses or midwives. Enrolled nurses involved by telenursing need to be under the supervision of registered nurse or midwife. Nurses and nurses and midwives practicing telenursing are personally responsible for ensuring that their nursing and or midwifery skills and expertise remain current for their practice. Nurses and midwives who are practices telenursing in Australia are affected to practice with is the framework of the ANMC National Competences Standards of the Midwife, the ANMC Code of Professional Conducts for Nurses in Australia, Code of Ethics for Nurses in Australia, and other relevant professional standards. Nurses and midwives should inform consumers of the telehealth process, including other persons, professionals who may be participations or presences, the telehealth consultations and Urban consent before proceeding. Nurses and midwives in televisions have a duty to provide privacy and confidentiality in all interactions. Nurses and midwives practices in telenursing should be aware of both the evidence base for their practice and the areas or practices need or research. Nurses and midwives practicing telenursing should engage in evaluation of their practice in relations to issue of quality, safety and patient outcomes. Issues in TELENURSING. Models of case. Privatizations. Work-line throw nursing staff. Patient safety. Cross-border license issues. Clinical functions of the telehealth nurses. Telehealth nurses are monitoring patients with chronic diseases, helping patterns manage their symptoms, and coordinations care of patients who require service from home runs health professionals. Benefits of TELENURSING. When patients stand seeing of their own, they stand connecting the data above their processes, managing the disease better, reduce their utilization of acute case services such as emergency department visits and hospitalization, saving time achievable because driving time to reach patient residence by significantly reduced. Nurses are able to spend more time on direct patient care. Telehealth nurses provide nursing care by using clinical algorithms, protocols, or guidelines to systematically assess patient needs and symptoms, prioritizing the urgency of patients' needs, collaborating and developing a plan or care with the patient, and supportive disciplines which may include recommendation for cure, callback, educations, evaluation outcomes. Thank you.